Remember this stuff? After the hottest summer on record, the heavy snow and freezing temperatures from earlier this year seem like a distant memory. But the region's health bosses have been busily planning for the next cold snap, and they've got some fresh ideas to help ease the pressure.
Winter is sort of a year-round business really in health. As soon as we finish with one winter, we're starting to look ahead to the next one to make sure that we've planned the services appropriately. What new services do we need to build in? Every winter is going to get more and more busy. We've also got an ageing population. People are getting sicker and sicker. We're managing to keep them well at home, but they're on lots of medications, and it doesn't take much, just something minor that you or I wouldn't think twice about, for them to really be knocked off their feet.
Some GP surgeries are able to extend their opening hours this year thanks to extra money from the government, and more services are now available online, but the sector remains extremely stretched. Hospitals were also hit hard by the weather back in February and March, with appointments and operations cancelled and A&E departments struggling to keep up.
We have to look at a variety of different scenarios that may impact on the system, whether that is inclement weather, whether it's high levels of flu, and we make sure that we develop our plans to take account of all of those scenarios. And it's part of the culture of the health and care system to review and evaluate what we did well, but also to reflect on the things that we didn't do as well as we would have liked. And that's been a very important part of how we prepared for this winter.
Every year the demand increases, the pressure increases, money is ever tight. We have to prioritise calls. There's a myth out there that all our ambulances can respond in any weathers, but the reality is they are just vans that are heavier. In actual fact, there was stories of ambulances driving in front of snowplows just to attend responses. But yes, we have to go, and it is very challenging for our staff.
So as winter rolls around again, the NHS in Devon is as prepared as it can be. But the public are being asked to do their bit by changing the way they ask for help. Minor injury units can take some of the strain by diverting people away from A&E.
The emergency departments need to concentrate on those patients who are acutely unwell, who have got significant injuries or who are having cardiac events. So the minor injury units can actually take those people away who've got broken bones, where people have tripped up and fallen and have either broken their ankle or their wrist. And people who've fallen and cut their heads. We can take all those people who would have previously gone to the emergency departments with injuries and see them in other facilities.
Last winter there were around 235,000 visits to A&E in Devon alone, many of which could have been dealt with elsewhere.
People are still confused about where they need to go. There is a lot of advertising out there, so hopefully people will get the message and will understand where to go.